Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. Three important issues I wanted to bring to your attention this month. The first is the George and Dina Brees Fellowship NAAOP has sponsored for the last 5 years. We are looking forward to our 2024 fellow who will start in late May and end his or her fellowship in early August. This is a fellowship where the fellow will learn about orthotic and prosthetic advocacy and policy in the context of the broader disability and rehabilitation community movement. The Brees Fellowship is now open. Applications are being accepted. The deadline for applications is February 19th. We encourage everyone hearing this video to promote and to tell people who you think might be good future Brees Fellows to apply for this summer's fellowship. It's open to anyone who uses an artificial limb or a custom orthotic brace and has an interest in public policy and orthotic and prosthetic healthcare policy and advocacy. Please go to the www.naaop.org website for more information on the fellowship and the application itself. We'll also be hosting a webinar, one that we hosted last summer. We're going to essentially repeat it for those who may not have been able to listen or watch it. The reason we're doing this is because the Medicare Advantage program has a whole new set of rules that allow providers and patients to challenge denials of care based on prior authorization. And so if you're being denied a prior authorization request for orthotic or prosthetic care, or your patient is being denied, there are new rules you can use to your advantage to challenge those denials. And so we'll be walking through in depth exactly what those rules are and how to use them, citing a chapter and verse of the regulations to push back on MA denials. With Medicare Advantage serving more than 50% of Medicare beneficiaries, these new rules, which went into effect on January 1 of 2024, are really important. And we want to make sure that our membership and the entire O&P community is well familiar with them and is using them to operationalize them to the advantage of your patients and for the providers who serve your patients. Finally, a big victory in the last few weeks when the Medicare DME MAC medical directors announced a proposed local coverage determination to cover fluid, pneumatic, and microprocessor prosthetic knees for K2 Medicare beneficiaries. As you know, K2 Medicare beneficiaries are defined as limited community ambulators and have not had access to these prosthetic knees in the past, what I'll call advanced prosthetic technology. There is a proposed local coverage determination, or LCD, that would do just that. It's open for public comment. The comments are due on March 2nd. Please go to the NAAOP website for more information, or to the DME MAC medical director's website for more information on how you can submit comments. It's an incredibly new and effective and important policy for the O&P profession and especially the patients that we serve. And we're really looking forward to finalizing that policy, which will allow dramatically enhanced access to care to these advanced prosthetic components for Medicare beneficiaries who are of a lower functional level than those who have been able to access these technologies in the past. Tremendous victory. There's a lot of people that deserve thanks. Wanted to make sure that you are well aware of this policy and that you comment strongly supporting it. And look to the NAAOP website for talking points and as to how to go about making these comments in the near future. Thanks so very much.